couple of interesting stories that popped up this week. One, there is some information coming out of the American group of oral surgeons, and they are starting to look at these weight loss medications. And to be specific, it is the, it's the GLP-1s or the glucagon-like peptide receptor, like Ozempic and some of the other ones that are out on the market today. These have become incredibly popular. And so certainly, if you're not asking those questions or don't have it on your health history, it's probably time to update to make sure that you're including that as listed prescription medications. But it looks like there may be some impact in our world, and they're reviewing now anesthesia ramifications, if you will, for patients who are on these medications. They're already considering drug holidays for patients who are taking the medication, not to take it right before or right after you have anesthesia. Now, in this particular article, it doesn't specify what level of sedation we're discussing. I don't think we're talking about local, but could be mild, moderate, or conscious, or GA. But the American Society of Anesthesiologists are starting to look at some of the potential side effects if you're on these medications and you undergo anesthesia, which could include blood clotting and some other issues that were starting to pop up on some of these patients. So I do think we may see some updates. So if you are sedating in your office and doing that on a more regular basis, you might want to just keep a pulse on the AAOMS review. And also, I'm sure the dental anesthesiologist group will also be looking at this as well. So looking at those regulations related to that medication, and certainly asking those questions before putting a patient through sedation to make sure there's not going to be any consequence. As of right now, they are at least recommending a drug holiday. If it's one you take daily, not to take it the day before or after surgery. And if it is the week type of medication where you only take it once a week, then they're asking you not to take it the week before. This is for elective surgeries. Obviously, the bigger concern or risk here is for those unelective emergency surgeries that pop up. You need to have your appendix taken out. You have a gallbladder issue going on, something like that comes up. And if you've had the medications, how do they manage those potential complications that could arise from taking Ozempic and some of the other ones out there? So just a heads up to let you know that this is certainly an ever-evolving area now that these particular types of medications have really taken a pretty big hold in the marketplace. Another interesting story that came out of California this week, actually it was right between New Year's and Christmas. A dentist actually died during treatment while treating a patient. He collapsed chairside, and that was immediately reported to the California medical group, occupational safety health group there, and they're continuing to investigate. But it sounds like it was a massive coronary event. But it certainly does bring up an interesting discussion on, what that even looks like and how you handle it. More importantly, that you have all of your affairs in order at your practice as well as at your home, because these things certainly can come out of nowhere and leave both your staff, your team, and your family in a bit of a lurch trying to figure out how to manage everything. And unfortunately, in my case, it would be how to figure out my passwords because I'm constantly already locked out. So there would be no way for them to ever get into anything, which would be really unfortunate in the event that I was no longer here. So that's actually a PSA for myself to really work on that and get better. And with that, that's the news.